Lyme disease, it's not in the same league as H1N1 or the West Nile virus, but is that just a matter of time? Lyme disease is tricky, hard to treat, and sometimes even harder to diagnose. Some victims of the disease see themselves as lepers and accuse the medical establishment of ignoring their plight. Our Beatrice Politi has more.
The doctors just didn't really have a clue what it was.
I couldn't get in and out of my house.
It is an epidemic in the States and in Canada.
It's going to put the nation on the knees.
A Lyme disease denial, that's what we have by the medical profession.
Every day, Robert Manton hooks himself up to what he calls the big gun of antibiotics, a doxycycline IV.
The first week when the symptoms started, it felt like I had a very, very bad case of the flu. And then the week after that, I started having migraines every single day, and that went on for months.
Then came body pain and muscle twitching and mental confusion. After 10 months and 18 different doctors, Manton had an answer: Lyme disease.
Lyme disease is a bacterial infection brought on by the bite of an infected tick. Ticks themselves get the bacteria once they've bitten infected animals, including mice and squirrels.
Manton traces it back to a 2004 camping trip near Brantford, Ontario.
There was a whole slew of ticks around our campsite.
Ticks are found lower than you think, and about this level, and they'll be often stuck to a tip of that point of that leaf, and when you walk by, it'll hang on to your sock, and it'll usually go under your body and get into the groins, into the axilla, and the back of the hair. They know exactly place to go, not to be detected.
Janet Mitchell believes she was bitten while on a walk on the north shores of Lake Erie.
When we came out, there was actually a Ministry of Natural Resources sign that said, please stay on the path. Ticks which cause Lyme disease have been found in this allotment.
Mitchell soon developed a red rash, which looks like a bullseye.
When I went to the doctor, he said, oh, don't worry about it, it's nothing.
Yet that bullseye-type rash is a classic sign of early Lyme disease. Other initial symptoms tend to be vague, including fever, headache, and fatigue. The bacterium causing it is called Borrelia burgdorferi. It's a spirochete, or corkscrew-shaped bacteria, that can wind its way into the tissues of the body. Tick areas in Canada appear to be relatively sparse and concentrated mostly along the border with the United States. U.S. surveillance shows far more widespread tick activity. All those ticks add up to at least 27,000 reported cases of Lyme disease every year, according to American statistics. But the U.S. Centers for Disease Control suspects the real numbers are probably 10 times higher. Here in Canada, Lyme disease cases only number in the dozens across the country. Numbers disputed by some doctors and Lyme patient organizations who continue to petition the government, accusing them of lax surveillance and inaction on what they say is a major public health threat.
It is here, but we're not diagnosing it.
Canadian health officials, on the other hand, say the risk over most of Canada is quite low and the disease still quite uncommon.
There is increasing risk. People are acquiring infection, but it's not an epidemic in the way that one could think of H1N1.
To be counted as having Lyme disease in Canada, you must have positive lab results. There are 2 standard tests, but they're not definite indicators of the disease.
That test basically isn't worth the paper it's written on. And we didn't know that, my doctor didn't know that.
Further testing in the U.S. confirmed Manton had Lyme disease.
The interpretations done in some private laboratories in the USA are too liberal, and therefore they capture as being positive a lot of people who are actually don't have Lyme disease.
Though Canadian health officials still admit the mandated tests are relatively insensitive in the early stages of the disease.
It is possible that some people may be infected and yet be test negative, and so it's important that doctors are aware of the clinical signs.
But in practice, doctors are very much divided on how to diagnose Lyme disease, where it might exist in Canada, and how best to treat it.
Doctors agree on one thing.
If you catch it early, okay, you can totally cure it.
And if you don't?
The patients quite often suffer more serious neurological arthritis and occasionally cardiac problems.
Some doctors say those kinds of problems are part of what is called chronic Lyme disease, which they say requires long-term antibiotics, months if not years in some cases. But Canada has no Lyme disease treatment guidelines of its own. We rely on those of the Infectious Diseases Society of America. It says 30 days worth of antibiotics is the maximum, and that chronic Lyme disease doesn't exist. But here's the twist. Those very guidelines were the focus of an antitrust investigation. Connecticut's Attorney General alleged some members of the panel had financial interests in drug and insurance companies, which could use the guidelines to deny coverage. The investigation also found the panel excluded or ignored relevant medical evidence. Those guidelines are now under review. So with questions swirling around guidelines, the views of some that tick surveillance is potentially inadequate, and concerns around the accuracy of lab tests, both Dr. Joseph Kropp in Ontario and Dr. Ernie Murakami in British Columbia relied heavily on patients' symptoms to diagnose Lyme disease. They call themselves doctors of last resort. Both used controversial long-term antibiotic therapy, they say, with excellent results.
27 people I've taken out of permanent wheelchairs.
Both have been investigated by their respective medical colleges. In 2007, the College of Physicians and Surgeons of British Columbia began investigating Dr. Murakami.
They went through all my Lyme files. They couldn't find anything.
The college would not disclose specific details of the investigation. It was never concluded, as the college says Dr. Murakami voluntarily retired. Dr. Murakami claims he felt pressured to retire. A decade ago, the College of Physicians and Surgeons of Ontario found Dr. Kropp guilty of professional misconduct in the care of some of his patients for using methods of diagnosis it said were not scientifically proven, although that case did not relate to Dr. Kropp's treatment of Lyme disease. Now he's under investigation again. Dr. Kropp says this time the college took the files of his Lyme disease patients. The college would only confirm Dr. Kropp is under investigation, but would not disclose why. Dr. Murakami says these types of investigations leave most doctors afraid to treat chronic Lyme disease.
They're intimidated, they're scared. Do they want to risk losing their livelihood?
And perhaps with good reason. Several U.S. doctors lost their licenses after treating Lyme patients. It was 4 years before Mitchell was properly diagnosed.
My first diagnosis was multiple sclerosis. Go home and live with it.
Lyme disease can be a trickster, mimicking many other conditions, including multiple sclerosis, Lou Gehrig's disease or ALS, Parkinson's, and Alzheimer's. One study has shown Lyme disease present in the brains of Alzheimer's patients. Janet Mitchell is now on long-term antibiotics and says she's getting better. But both she and Robert Manton say none of this had to happen.
There's no reason that I've been through this.
It really turns your life upside down. Getting sicker and sicker month by month and not knowing why, that was tough.